This is One on One. We are pleased to welcome Sandra Powell-Elliott, Vice President, Life Sciences and Innovation at Hackensack Meridian Health. Good to see you.
Hi, good to see you.
This is a twofer. This is part of our Women in Leadership series,
Yes.
Great women who happen to be leaders, and also the future of healthcare, particularly the focus on innovation, right?
Yep.
By the way, where'd you learn to be a great leader?
Oh my God. Actually, from my father. My father was a great leader.
How so?
He listened to people, and he collaborated a lot with the folks that he worked with.
It's interesting you talk about collaboration because you argue that innovation, quote, is about collaboration. And
Absolutely.
Then you say that you believe strongly from your professional experience that women are better at collaborating, therefore engaged in innovation,
Absolutely.
than men.
Humbly, I give you
And please
that.
make the case as I argue with
Well,
you.
absolutely.
As we talk about collaboration. What do you got?
I think women are very good at collaborating because they're used to collaborating. Because it requires a lot of number one, focus on a core problem, and then bringing elements together of people and pieces of problem-solving elements together to solve that problem. And sometimes men are not as comfortable bringing a lot of people to solve the problem, and more focused in on being the person or the key to solving that problem.
I'm sorry, you're talking about men in general
Men
or
in
men
general.
sitting across from you
No,
right now?
men in general. Men in general.
I want to clarify this.
Yes.
So you say men sometimes disproportionately come in and
Sometimes.
say, here's the problem, here's what we're going to do, let's fix it.
Yes.
That's not collaboration?
That's not collaboration.
Isn't that leadership?
No, that's not necessarily leadership. No, and leadership is more about helping people get to core goals and core outcomes.
Sometimes that takes a lot of time, the way
It takes a lot of. It does take a lot of time, but the question is, what's most important: getting to the goal, and making sure that people have the skills to get to the next goal the next time, or is it about getting to the goal quickly? And so the how is just important as the what.
Oh, you know I'm playing devil's advocate.
I know you
And I
are.
agree with everything you're saying.
Thank you. That's good.
Women,
Yes.
STEM, science, technology, engineering, math.
Yes.
Talk about that whole piece.
You know, it's interesting because I grew up as a little science geek.
You did?
I did.
How
I
do
was
you
a little
define
science. I just loved everything about nature and science, and I wanted to grow up and be a physician, actually, or a vet, because it's all about science. But I got a little tired going through college, and I just wanted to get out and make money. And I realized I was very good at business, and so I started leveraging that within the healthcare sector, and that's how I got into healthcare. And as I began to realize is that I really liked kind of pushing the envelope of both science and business. And one of the things that I think is very interesting about that is that women are still a little bit uncomfortable pushing the envelope of being a little shy in science, technology, engineering, and math. And I think that we need to be very more comfortable, a lot less shy around science
Can I
and
use a word?
technology.
I'm sorry for interrupting.
Yes.
Assertive?
Assertive.
More assertive?
Assertive is an okay word. There's nothing bad about.
Are you saying that they have the information, they have the knowledge, they have the commitment, and they sometimes hold back?
I think there's a certain level of discomfort in just embracing. If you're interested in something, embrace it and go forward with it. I don't know that a word of assertive is a critical issue or a critical word to use. You should be comfortable in your own skin and embrace what you like and love and just go with it. If it means being assertive, dare say aggressive, be aggressive with
Sandra,
it.
when you got into healthcare and the technology piece, the innovation piece, a lot of women?
Not that many women.
Changed dramatically?
It hasn't changed dramatically.
Too slow?
Yes, very slow. And I think that there is a lot of barriers still. And I would say that not only in just healthcare, but in innovation in general, quite frankly. We have within Hackensack Meridian what we've really focused a lot on, not just internal but external innovation, and bringing innovative companies into the organization to solve key problems.
Couple examples.
That we have, and I'll
Sure.
tell you, we've got companies that we look to solve problems like infection control, medication adherence, those kinds of things. And we don't see a lot of companies that are driven or developed by women coming to the table, and we look for those. And a lot of it's because venture capital companies don't put money in companies that have been developed by women or technologies that have been developed by women. So one of the companies that we've actually been, that's made it through what we call our Shark Tank version, which is Bear's Den.
I've heard about it.
Yeah, it's a very
challenging.
Yes, it's challenging event to get through, but you get through it, and it's called Pillow Health, and it's a little robot with voice recognition. It's got facial recognition. It dispenses medication. It has.
I'm looking at it right now. Wow.
It's a very unique device, and it actually has a little personality, and our older population as well as younger populations actually like this device a lot. And it enables people to have more control of their own health and wellness in their home. So it's almost like a home health hub, if you will.
Before I let you out, mobile communication, mobile device is going to have more and more connection to health?
Absolutely, absolutely, because it's with you. It is an extension of most people. And it's a computer in our hand, and it's processing capability. So it enables us to maximize data collection, data aggregation, and actually feedback loop to you as an individual about your own health. So yes, absolutely.
You love what you do.
No, I don't. Yes, I do.
It comes across.
Good.
It's a great quality.
Yeah.
Part of leadership is about passion.
Passion,
and
absolutely.
you have it. Sandra Powell-Elliott, who is Vice President, Life Sciences and Innovation
Yes.
at Hackensack Meridian Health. I want to thank you for joining us.
Thank you very much.
Well done.
Thanks.
Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Georgian Court University, Valley Bank, Horizon Blue Cross Blue Shield of New Jersey, the Russell Berry Foundation, the Healthcare Foundation of New Jersey, Summit Medical Group, and by Adler Aphasia Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.